Pelvic pain is not always about the floor. Sometimes it's about the walls. I'm Erin at Femina Physical Therapy here in Atlanta, and we're going to go over how your adductors can really contribute to pelvic pain, hip pain, even low back pain, and how it can be critical to include these in your pelvic health program. So your adductors go along your inner thighs up and connect midline on the pelvis. So because of that, when they're tight, they can really pull on that pubic bone and create tension in the pelvic floor and your hips, creating pain. But this pain doesn't always just stay localized right there. It's not always just about the pain. It can also affect your movement. So things like sitting, standing, exercising, they can become painful. You can feel a lot of tension or restrictions in those movements. It gets even more in depth. So your adductors are part of the deep frontal fascial line, which is basically a network of connections from your legs connected up to the pelvis, your diaphragm, even up until your jaw, which is crazy. And this is why when people are having pelvic pain, it feels like it travels. It doesn't stay put. Or you have pain here, 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 and here, not just one spot. It can be in your hips. It could be like a restriction in breathing. It could be your jaw. You have to kind of look other places. So people kind of think of pelvic pain as just being a pelvic floor issue. And while the pelvic floor for sure matters, you can't just stay there. You gotta look at these adjacent muscles and joints when you're treating it. So the adductors are definitely part of what should be the plan of care. Think of it this way. Think of your pelvic floor as a base or floor and your adductors as these walls. Well, if your walls are like a little wonky or askew, it's gonna pull on that pelvic floor or your base. So that's why incorporating the adductors into your treatment plan, it's just critical. You just have to do it. The good news is stretching is a really great way to release the pelvic floor and help with this pain. Now, old school static stretching is great, no problem with that at all, but I really like to incorporate some PNF methods into my stretching. So PNF is proprioceptive neuromuscular facilitation. It's a mouthful even for me, the professional, so we're just gonna call it PNF. So the reason I really like PNF is it incorporates gentle contraction with relaxation during the stretches. This helps tap into the nervous system, sorry about that, and helps it to facilitate letting go of this unwanted tension and pain. So it works on your flexibility, but it also works on mobility or control, motor control, and stability. So it's a little bit of a hat trick, which I love getting more bang for your buck. I'm all about that. So I just want you to remember, like again, it's not always the floor, it can be the walls, and we can release the adductors. There's something that we can do. So in my next post, I'm really gonna in-depth go over the stretches that I like and that I prescribe to my patients who have pelvic pain. And I'm gonna keep it really with just 2 stretches and maybe 1 exercise. I don't wanna overburden you. I think if you give people too much, they're gonna tune out and probably just not do any of it and can feel overwhelming. So make sure you subscribe, tune in, so that way you don't miss it. Have a great day.